Afternoon. Thank you for joining us for Social Justice Coffee Hour done together with MUSC's Conversation Cafes. Thank you. So what I'll do is I will go ahead and get us started with some brief introductions. My name is Marla Robertson. I am an advisor for the Social Justice Coffee Hour intern who works primarily out of the Center for Sustainable Development. And a lot of the work that the Social Justice Coffee Hour does is centered around giving our students an opportunity to not only engage in topics that relate to social justice issues, environmental justice issues, but then it also gives who work in the internship capacity an opportunity to create and articulate these different events. I will start by introducing our first panelist. Omar Muhammad is from Augusta, Georgia, where he has earned his biology degree from Augusta State University. He currently works for the Department of Natural Resources as a fisheries biologist. He is married to Tawana Muhammad for 17 years with their son Amir, where they were in Charleston, South Carolina. Omar has worked as a communication advocate since 2007 and is a volunteer for the Low Country Alliance for Model Communities, which we like to call LAMC. He has served as LAMC's website content coordinator and community engagement liaison. Currently, he serves as LAMC's executive director. Omar has completed a 9-month training with the United States Environmental Protection Agency and Region 4 and the Environmental Justice Academy and was selected valedictorian for the inaugural class. He's also a past participant in a joint EPA Region 4 and South Carolina Department of Health and Environmental Control leaders in Environmental Action Pilot, which is called LEAP, in their inaugural class. He has successfully led efforts to engage the LAMC communities through various outreach strategies. Omar has successfully funded community research, initiatives to train residents, conduct community-based health surveys to assess health service gaps at the community level, conducted a zoning analysis for environmental justice communities, and several other citizen science projects. Omar has been instrumental in leveraging relationships with academic and governmental agencies. Omar has also been instrumental in securing mitigation dollars totaling over $4 million to address the qualities of life concerns in low wealth communities. Specifically, he has led efforts to create the only community land trust in the city of North, negotiated $4 million in mitigation with the Palmetto Railways, led an effort to complete the very first community benefits agreement for local communities, and a warehouse developer. Omar is currently pursuing his master's in community and urban planning with a policy focus at the College of Charleston to move the LAMC organization into becoming a community developer. So we appreciate all the wonderful work that Omar has done, and I'll pass this along to John.
Hey everybody, so also joining us on the panel today is Dr. Vijay Vulava. Dr. Vulava is a professor of environmental geochemistry at the College of Charleston. He has a graduate and graduate degrees in environmental engineering and sciences. For the past 25 plus years, his research has focused on studying pollution of water and soil environments. Currently, he focuses on how stormwater runoff will impact our coastal environments and our health. Thank you for joining us today, Dr. Vulava. We also have Dr. Brian Bossack. Dr. Bostic is an associate professor of public health at the College of Charleston. His research interest lies within spatial and environmental epidemiology, the analysis of disease and health related to space and place mediated by human environmental interactions. Examples of published research include studies on historical pandemics, including transmission patterns during the Black Death of the Middle Ages, vector-borne diseases spread by insects, climate change in health, including heat-related illness, and changing risks from natural hazards. He recently completed studies on environmental associations with 1918 Spanish influenza incidence and mortality, as well as Charleston's experience with the pandemic. Just before COVID-19 emerged, he is currently actively supervising research on spatial variations on COVID mortality associated with ambient PM, or I think that's particulate matter concentrations. The impact of universal viral precautions on the risk of syndemic COVID-19 and annual flu, this cold season cycle, and an exploration of environmental factors in blue zones. Dr. Bostic possesses degrees in geography with a focus on geospatial techniques from the University of Georgia, a PhD in geography with a focus on climate change and natural hazards from Florida State University, and an MPH in occupational and environmental health from Emory University. He previously served as a contractor in the Division of Global Migration and Quarantine at the CDC, and has provided COVID-19 response support to the Lowcountry EPI data team at South Carolina DHEC as a member of the Public Health Reserve Corps. Any opinions expressed are solely his. So thank you to all of our panelists for joining us today. And with that, I'd also like to thank Jane Parties and Rachel Whitbeck. So Jane is with the College of Charleston and Rachel is an intern here at MUSC, who will be our moderators for the session today.
Awesome. I'm Jane Parties. I'm the Social Justice Coffee Hour intern with the Center. Our first question for the panelists is we've all heard news stories about how the pandemic has had a disproportionate impact on Black, Indigenous, and people of color. Can you please speak to what is happening in terms of COVID outcomes for these communities? And this question is open to all the panelists.
Okay, well, I guess I'll try to tackle some of the response there. So there are, I would say, clear disparities in terms of rates, particularly related to outcomes, and in particular related to mortality, that have become clear as the pandemic has progressed in terms of the effect of COVID-19 disproportionately on African Americans, Indigenous Americans, the Latin community as well. And so where some of the data show this to be particularly acute is when one looks at rates. So in particular, rates of mortality from COVID-19. So for example, American Public Media, which has been doing research on statistics during the COVID-19 pandemic, has found that as of fairly recent data, as of about mid-November, the estimates were about 1 in 875 Black Americans have experienced COVID-19 mortality. 1 in 925 Indigenous Americans have experienced COVID mortality, and 1 in roughly 1,275 of those in the Latino or Latinx population have experienced mortality. That's in comparison to about 1 in 1,625 white Americans and 1 in about 2,100 Asian Americans. So there is evidence in terms of the rate of mortality per, for example, 100,000 people or per self-identified ethnic groups, that there are differences in mortality. And when these are factored out into kind of risk zones or more likely to zones, then the data suggests that Indigenous Americans are about 3.2 times more likely to die of COVID-19 than whites, with Blacks and Latinas at around 3 times more likely to die from a case of COVID-19. There's a lot of factors, I think, that go into those statistics, and hopefully we will kind of explore some of those factors as we continue forward with the discussion today.
Thank you so much. My name is Rachel. I'm one of MUSC's sustainability interns. Does anybody else have something to add? If not, we can move on to the next question. Okay. The next question is, what environmental factors can make communities more susceptible to disease in general and specifically to respiratory diseases? So anybody can add something here.
I can get us started. I think some of the factors that Brian mentioned also make sense for environmental factors as well. But in generally speaking, proximity to contamination sources or proximity to emissions, whether they're from factories, whether they're from highways, those would be one of the very, very common, the factor that would tie communities with health outcomes. I think there's environmental factors. I think more recently, even issues such as climate change, they're also starting to play a role, especially because out west we've been looking at forest fires. Those forest fires generate so much air pollution. They raise the amount of PM particles significantly, even in communities not impacted by forest fires. So the health outcomes are pretty bad in those areas. In areas that have very little rain because of drought conditions, the air quality generally is also something that's impacted significantly. But in general, being close to those pollution sources, wherever they might be, are by far the most significant factor. And generally speaking, those factories, those incinerators, those construction sites, these tend to be predominantly in areas that are lower on that economical, the ladder that we often see with communities. I think that's one of the biggest differentiator for communities that are healthier in comparison.
Thank you. Do any of the other panelists want to add anything to that question? Sure. You can continue. My next question is for Omar. I'm not sure if he's on the call yet.
I am.
Oh, okay. Great. So we were interested in asking, for those unfamiliar, how would you describe or define environmental justice? How is social justice and environmental justice intertwined?
Yeah, so for us, the Environmental Protection Agency has one of the best definitions for environmental justice. So environmental justice, as they define it, is the fair treatment and meaningful involvement of all people, regardless of their race, color, national origin, or income, with respect to the development, implementation, and enforcement of environmental laws, regulation, and policies. We fully embrace this definition, and we take it a little further by emphasizing the meaningful engagement of marginalized communities and incorporating quality of life concerns when it comes to affordable housing, economic development, education, and environmental justice as integral parts of the definition of environmental justice.
Thank you for sharing.
Awesome. If no other panelists have something to add to that question, then we will move on. The next is, how has COVID-19 amplified disparities in healthcare and access to healthcare? And what are some ways that healthcare providers and supporters can mitigate some of those racial or ethnic disparities during the pandemic?
So I think this is a key issue and one that needs some overarching attention because disparities that we're seeing in, for example, in COVID mortality, I don't think they're independent from structural disparities that have existed for quite a while in terms of things like access to care, in terms of things like affordability of care, particularly related to maintenance of chronic conditions or improvement of chronic conditions. And we know from some research that significant percentage of mortality that has occurred during the COVID-19 pandemic is associated with comorbid conditions. In other words, people had other illnesses, and when they were infected with COVID, it just basically added more difficulty for their bodies to fight off multiple things going on at the same time. The number one associated factor that I've seen associated with COVID mortality is hypertension. In one study, they found about 70% of the people who died from COVID-19 were also suffering from a significant level of hypertension. And so it kind of worsens conditions that are already difficult for those who are suffering from them. I think that the socioeconomic difficulties that are also associated with the pandemic are exacerbating issues related to access to care and maybe perhaps influencing disparities that we're seeing. So for example, a recent New York Times article notes that about 8% of doctors who were surveyed in a very large survey said that they were closing their private practices. And so in a sense that restricts even further access, which is already difficult in many cases. And we know that when access is restricted, people who have a health issue or who are juggling work and making decisions about going to work or going to see a doctor and having to choose one or the other may choose to wait until they feel like the situation is quote unquote bad enough to go see a doctor. Now, if that happens, that can make any disease that's on top worse. And so I think that two of the issues that stand out to me, in my opinion, are both access to the care, physical access to the care, and then affordability and financial access for particularly earlier preventative care. Yeah, I'll just add to that a little bit more because I was just thinking one more thing, is that I think this also relates to testing as well, because sometimes, particularly if testing is not located where the need is, it can be hard to get to where the testing is. And so I know there's been a huge push and a lot of work to expand testing availability and access. But at least, I think at the beginning of the pandemic, particularly, it's a challenge. It's a challenge to get enough testing to enough people in enough places where they would like to be tested. And sometimes being able to physically get transported to where the testing is challenging and something that also needs to be accounted for.
Do you think these challenges of testing and accessibility are being addressed in Charleston currently?
I mean, my personal opinion is that I think that people are working on this very hard and trying to make headway on these issues, constantly working and trying to find out where the issues are and try to address them. I do feel like there is a push to address these. Yeah, that's my opinion.
Thank you. And do any of the other panelists want to chime in? We can move on to the next question. Okay.
I just had a comment on the previous question about structural problems. I think Brian and Omar covered a lot of those issues, but a lot of these problems are also already existing in these communities, not just based on the race, but also some of the environmental problems have already been causing health-related issues for a lot of these communities, which happen to be in areas that are very prone to environmental contamination. So the health outcomes were already poor, and on top of that, with the COVID, hitting these same communities, I think it's made it even worse. So it's probably just amplified their health issues even more.
Thank you. Our next question is, what types of activities and industries produce this PM 2.5 air pollution and where? How can we protect ourselves and our communities from these risks in the near future?
Okay, I could try to tackle that and turn things over to my colleagues on the panel. I guess I'll start with very basic perception of this issue. And I think it ties back to the first question, which was about environmental factors that could make communities susceptible to disease in general, and particularly respiratory disease. So I'm working on some research right now, which is looking at spatial differences in mortality from COVID-19 related to ambient air pollution. And what keeps coming up is this PM, which is kind of an acronym that is used throughout environmental health and environmental studies, which involves particulate matter. And there's different sizes of PM. You could think of one of these acronyms that is used as PM10, just think of it as larger, PM2.5 is smaller, and the PM2.5 is what most research suggests is something we need to worry about, because it's small enough particles that it can get deep into the lungs, cause irritation. In some cases, it could influence cardiovascular disease and other conditions of morbidity. And so one of the things we're looking at right now are example papers of where people have studied previous respiratory diseases. So we looked at papers on air pollution in China and SARS. SARS was a cousin disease, so to speak, of COVID, came out in 2003. And the research showed that there was an increased risk of mortality from SARS in places where air pollution was high. Another thing we've been looking at to really investigate this further is something that right now I think is incredibly interesting. It's tangential to our discussion today, but it provides an example of how space and place can influence health, particularly over the long term. And that is why so many people are dying in Italy in the northern part of the country, right? So the Po Valley is this area in northern Italy where you have, that's the economic powerhouse of the country. So you have factories, you have industrial processes, you have a lot of highways, a lot of cars. And if you pay attention to the news or you hear these stories coming out of Italy, there's a lot of stories about northern Italy suffering, having just an awful time going through this particular pandemic, where you're not hearing about hospitals being overrun in Rome, hospitals being overrun in Florence, hospitals being overrun in Naples. Why is that? Why is it that the largest, well, some of the largest population centers in the country are not experiencing the same levels of mortality that the northern parts of the country are? And so recent papers have come out and looked at PM2.5 concentration levels, these small particles that kind of get trapped in the air that people breathe in for days and weeks and months and years. And there is some evidence, let's call it significant evidence, that the amount of these PM2.5s, or how much of this stuff is in the air, particularly over the long term, influences people's respiratory performance and can cause significant issues when they get sick on top of having respiratory irritation. And so a recent study shows that for a 1 unit increase of a kind of small unit, it's called a microgram per cubic meter, 1 unit increase of this PM2.5 material, the risk of dying from COVID goes up by about 9%. And again, this is a model. All models have their issues, but there's a strong suggestion, at least in this area, that this air pollution, because people have been exposed to it for years and years and years, it is kind of, in a sense, maybe irritated their lungs to the point where if you get another infection on top that reduces lung function, it can make things so much worse. And so there is at least one explanation for why there is so much more mortality in that area versus other areas. And so now people are starting to look here in the US. And so an early study from early in the pandemic is now finding similar results. As that PM2.5 concentration over the long term goes up, then the risk of death from COVID also goes up by pretty significant percentage, roughly 11% in one study. And there's even been more research now that says that not only are these PM2.5s potentially making people sick, but smoking makes things even worse, it exacerbates it. And there's the possibility, this is still not proven, but there are still some studies now starting to suggest that smoke particles or other particles related to smoking could theoretically serve as a substrate or carrier for the virus. And nobody's yet ready to declare that smoking is a way to transmit the disease, but there have been some published papers which are looking at it as a potential additional way that the disease could be transmitted. So there's a lot of things going on, but I would say, like, when I saw this study from northern Italy and you look at where you have these red counties, and by red I mean they map it, which is kind of the techniques that I use, is mapping and looking at things over space, and you see just one county after, I'm going to call them counties, they're probably called something else in Italy, but you look at where the PM2.5s are high and the mortality is high and they're coded red and everything around them is gray, and there's 1, 1, 1, 1, 1. They're forming a line right along one of the main thoroughfares, highways. And so there's a strong association between what potentially could be polluting and what people are experiencing in terms of mortality from this respiratory disease. With that, I'll turn things over to my colleagues for additional thoughts.
All right, this is Omar. I wanted to just chime in a little bit on that from a community perspective and from a citizen science perspective. Since about 2009, LAMPC has been researching this issue around risk avoidance when it comes to particulate matter, both 2.5 and even smaller than that. We're starting to work with Dr. Pierce at the University of South Carolina to look at some smaller particulate matter as well, and looking at some of the health consequences from being exposed to those types of particulate issues. In regards to what are contributing to that for environmental justice communities, that is directly related to industrial operations that operate right on the fence line of environmental justice communities, as well as their location. Most of these communities are bisected. They are near roadways, highways, exits. So all this contributes in the cumulative impact from not only industrial operations, but also the movement of goods, rail, highways through environmental justice communities contribute to that cumulative impact of being exposed to particulate matter.
Definitely. Thank you so much. And Dr. Vulava, would you like to add about other types of pollution, maybe water, and how we can protect ourselves and our communities and where that comes from?
So again, just to add to what Brian and Omar brought up, again, environmental pollution, chronic exposure to the PM particles. I think the chronic exposure, that is the key here. These communities are being affected by or breathing in these particles for such prolonged periods. They're probably, even their indoor air quality is also compromised. It's not just outside, but also inside. And most people tend to spend a lot of time indoors as well. And if the air quality isn't that great in the inside of their own homes, that can also contribute to some of these same issues. And if their immune system is already compromised and now we have COVID on top of that, it's no surprise that they're being more impacted by COVID, I think. And I think that example that Brian just brought up, Northern Italy, the urban areas, the factories, the industrial powerhouse of Italy, that region of Italy, they're obviously probably already have poor health and outcomes compared to the southern Italian towns. I don't know if that's the case in the US, if all the urban areas that been hit hard by COVID, are they also consistently have poor health compared to rural America, but that's not what we're also seeing. You know, rural America is also getting hit pretty hard by COVID, and it cannot all be related to PM 2.5. They probably already have some poor health, prior poor health because of other factors. So I guess there's too much information. It's very hard to parse all this information out and make those correlations. I think there's still a lot of, but the bottom line is PM and COVID. I think chronic exposure to PM will only make COVID worse in anyone. I think that is probably how I would go as well. In terms of water, Rachel, the question, was that about drinking water? What were you thinking of?
I was just meaning in general other types of pollution other than air.
Okay, well, floodwaters are a big problem, even in communities of color. We see that right here in Charleston. In areas just by crosstown, those areas often see a lot of flooding. And also likely some areas around some of the urban streams that we see in North Charleston. There's a lot of pollution in those creeks, and flooding, when flooding happens, obviously communities that live nearby are being exposed to all that pollution. And some of our recent studies have shown extremely high levels of pollution, trace metals, organic chemicals, bacteria in the floodwaters. Many studies confirm that as vectors of disease. So that's definitely an issue. That's a long-term issue. I think things are only going to get worse with very extreme rain events, extreme flooding that we're starting to see in these regions. So that's also going to make the problem worse.
Great. If I can interject real quick, I hate to derail this discussion, but for a quick moment, just a housekeeping note. I've heard that people are having trouble finding the chat function. Marla, I'm not sure if you have any other information on that, but perhaps, I'd really like this to be a interactive discussion. And if there isn't a way that we can kind of re-engage the chat function, I can send people to our sustain@musc.edu email address. I guess you can't see that due to the background blur effect, but sustain@musc.edu. Just like sustainability, but shortened, sustain@musc.edu. And if you can send those while the panel is talking, we can address them at the end. Marla, do you have anything to add there? I'm not sure if we can direct people anywhere else.
I'm going to double check on that chat function.
Great. Well, sorry to interrupt.
Dialogue. Thank you.
Awesome. Thank you. Okay, we will move on to our next question, I think, since everyone had a chance to answer that one about pollution. So next, and this one is more for Mr. Muhammad. What are the qualities of a model community and some examples of policies and programs?
Yes, ma'am. Thank you. I mean, that was an excellent question that was asked. For our organization in the communities we work with, a model community is some type of a geographical, area that supports the needs of those living there. It has all the amenities of a healthy and thriving community. Specifically for our organization, LAMC, we achieve this by creating healthy families through opportunities for home ownership, closing the education and economic gaps, and addressing legacy environmental contamination and health disparities. For our organization, we achieve this, right, by with our efforts, our current efforts, where we created various funding mechanisms to support our work. We created endowments, scholarships, revolving funds, trainings in our community, coalition, and networks which address the quality of life concerns identified by our community residents. Our end goal is to empower our residents to become the advocates for the change they seek. Our policy work directly addresses the needs in our community. We are working on policy framework for shared community solar, which is something that we are really promoting and trying to get passed through the state legislature. We're working on a zoning overlay policy framework called the environmental preservation districts, which restricts certain activities from being sited in a geographically defined area that is environmentally challenged. And we are also working on local zoning policy changes. And at the state level, we're working on this on a policy framework called the South Carolina Mini NEPA. And as many of you know, there is a National Environmental Policy Act. It does have some weaknesses when it comes to some areas of concerns at the local level, and we feel like strengthening the state environmental laws to include a mini NEPA provision within environmental frameworks will further protect marginalized and environmental justice communities in the state of South Carolina.
Perfect. Thank you so much. We only have one question left. Jane, did you want to ask that one?
Yes, and it kind of adds on to what you were talking about how can we hold our leaders responsible for addressing environmental injustices and protections? And of course, any of the panelists can chime in.
So I guess I can, Omar again, I guess I can kick us off here. Thinking about, that question, I think that this is another good question. First, we hold our elected officials accountable by educating them, right? Educating them on the issues that are important to our communities. What we have found over the years is that many of our local decision makers, that's at state, that's at the local levels, we find that they are not well informed on many of the issues and policies that they vote on, that they're making decisions that impact our lives. So we feel like educating them fully on issues of concerns in our communities is the very first step in holding them accountable. And sometimes that can be very challenging a part of the work that we do. Our policy frameworks, right? Those who work in the policy area, they must understand environmental justice and why it is important to address this in a meaningful way, right? We know and we advocate that addressing environmental justice benefits all of us. We must create spaces where marginalized voices are part of the discussions, the decisions, and the solutions. Low wealth communities hold our elected officials primarily by voting, right? It is the responsibility of the entire electorate to protect the sanctity of our voting process by expanding voting, not limiting it, right? And we hold our elected officials accountable when those with privilege, let me say it again, with all of us that have privilege, to use our privilege to push back on injustices. We cannot remain silent on these matters. In the words of our comrade, Honorable John Lewis, and I'm going to close with his quote, "Do not get lost in the sea of despair. Be hopeful, be optimistic. Our struggle is not the struggle of a day, a week, a month, or a year. It is the struggle of a lifetime. Never ever be afraid to make some noise and get in good trouble, necessary trouble." So this is poignant and very important, and we embrace the spirit in which this quote exemplifies.
And if I can add a little to the conversation, and I mean, kudos to Omar and his organization for pursuing things like solar power. I think that is so, just from my perspective, it is so important. If we think about, again, I'm not sure if I can say that there is a causative effect between the air pollution that people are exposed to on a daily basis, monthly basis, yearly basis, but I think there's an association between that exposure and if somebody gets sick, it can make them sicker. If certain conditions are met, it can make health conditions worse. And I think moving both with scientific support and through community support and with governmental support towards a decarbonization of our technologies so that we can still transport where we need to transport, so that we can still develop but in a more sustainable fashion, but reduce the carbonization footprint that has existed and has increased throughout the Industrial Revolution. There are ways to move forward that preserve economic opportunities, that preserve people's expectation and desires for rapid and efficient transportation without the polluting mechanisms, and particularly the concentrated pollution mechanisms that distribute not the benefits of these technologies, but the negative aspects of these technologies, don't distribute them equally in a sense. And so that some individuals in our community tend to suffer worse because of this exposure that continuously occurs. And so I think it has to be a combination of forward-looking processes and people's voices being heard and being part of a process that moves us from a carbon-based situation, whether that's plants sitting there and just polluting continuously into the sky, or whether that is diesel vehicles that are producing even smaller particles called DPM, which is diesel particulate matter, I should say. That stuff is even smaller than the PM 2.5. It's 1 micron or less. And that stuff really makes people potentially have issues, cardiovascular system and otherwise. And so just thinking about moving forward, working with communities working with government, and trying together to move towards a less pollutive future can help step by step move us into a situation where people's health could improve over time.
I also like to chime in a little. Omar, thank you so much for your work. And Brian, also thank you for bringing up the carbon pollution issue. But also some of us that are scientists, I think that work in these fields, it's also important for them to speak up. And I know a lot of scientists like to stay in their silos and not worry, not get too controversial with their opinions. But I think we should, as scientists, speak up and speak to the policymakers, because ultimately the policymakers listen to a variety of audiences, and I think a lot of times they get their messages from the industry more than the scientists, and that seems to be driving the policies in a particular direction and not necessarily to for anyone's benefit, especially when it kind of trickles down to the common people that are impacted. So I think that's probably where we could participate a little bit more in that process and make our opinions known. A lot of us are, I guess, pretty much every one of us are fairly intelligent people. We have opinions, but we are a little bit more educated in some of these areas. So I think it's for the common benefit to be able to speak out and share some of our knowledge. I think that certainly helps with the policies.
Thank you for sharing. I think we have a few questions from the audience. If Rachel, you would like to take that, or John?
Yeah, I can jump in real quick. So we had to pivot because we don't have the chat function as available as we thought we would, but you can email us at, this goes to me at sustain, SUSTAIN at musc.edu if you have a question that you want answered. But first I'd like to thank the panel for a lot of great words here and sharing their ideas and their knowledge with us. So David's question was, is it accurate to conclude that structural issues, being near pollution and low income, are key factors no matter what the race, but that those factors are frequently worse for minorities?
I would say that statement is correct, but also I would also add that communities of color and low economic background, they are also the people that tend to be living close to those pollution sources. So I guess that confirms it, but I don't know if it really confirms the part about race being a factor, but it could also be a factor, I would think.
Seems like it's kind of a demographics question of just who is in those areas.
Yeah, I think Omar could probably also speak. Communities of color tend to be the ones that happen to be next to pollution sources. That's also been my experience working in contaminated sites in a few other places. And it's often communities on that other end of that spectrum that happen to be close to pollution sources.
I mean, yes, that is definitely correct. When you looking at where unwanted land uses or facilities are cited, they're primarily cited in low wealth communities. Majority, I shouldn't say majority, but many of the low wealth communities that we work in tend to be minority communities. But that is not the case across the U.S. When you look at Kentucky, when you look at Virginia, you have communities there that are low wealth, but a different ethnicity or a different racial makeup, but they are challenged with environmental justice challenges when it comes to mountaintop removal and the pollution of their waters. When it comes to the construction of pipelines across indigenous communities or settlement communities, in the pollution associated with the operation of these types of facilities in low-wealth communities. It all depends on what that environmental justice concern is and the area in which that environmental justice is happening.
Thank you for your answers there. We have another question that just came in, and this is a general question. Will this recording be available on YouTube following this broadcast so we can inform others? That's a great question, and yes, I think we might have skipped over that a little bit in the beginning, but it'll be on both CFC Sustainability and MUSC Sustainability's YouTube channel. Ours is just under MUSC Sustainability. Jane, what is yours again?
It is Sustain CFC for the YouTube.
Perfect. Yeah, so it'll be on both of our channels. I think for us, it'll take probably about a week or so for processing and making sure we have it captioned. But yeah, please share this with others. We definitely want this information spread around.
I think there was a question. I have a question from the audience. Somebody asked, what can students do to help address disparities related to environmental justice issues?
I guess I can jump in here as well. Here locally, the LAMPS organization is working with students from the College of Charleston around better understanding environmental justice and the challenges in environmental justice communities. So I can say that that is probably the first step that needs to happen, is to just educate yourself, either by volunteering to work with an organization that is working on environmental justice concerns, reach out to our organization. We do have a training that we do provide that educate people around environmental justice and what is considered environmental justice and how these type of disparities happen in minority communities. So I will say, first, educate yourself, get involved with organizations that are working towards addressing these issues and concerns. And I will state this too: regardless of what career path we choose or what area of focus that we choose to work in, all of it relates to environmental justice. Anything that impacts people's quality of life is environmental justice. So we all work in the environmental justice movement, social justice movement. So that is important to take away as well.
I guess being curious, ask questions. Don't be afraid of asking questions. That's something that I always tell my students in classes. I think that's a good motto for most of our students too.
I'm somewhere in between, kind of trying to formulate a response to some of the questions about what can be done to mitigate against disparities, what can be done to reduce carbon imprint, because anything that we collectively produce, it affects others, doesn't necessarily stay in a box over us, and it affects others around us. And I think I totally agree with both what Dr. Vulava and with what Omar said about getting involved and finding your niche. I think everyone may have a specific area that appeals most to them. I know for myself, I'm an avid bike rider. And so, for example, that's something where you can have transportation that doesn't involve carbon pollution, at least not as much carbon pollution as driving an internal combustion engine. But that's one of those areas where it requires collaboration between community and government and the design of the built environment and making sure that there are safe mechanisms for people to experience activities or experience environmental exposures that are far more beneficial than they are risky. You know, for example, we have a greenway in part of the city, and it's a great experience when you're on it, But if you wanted to take that as a transportation mechanism, you have to have a raft to get yourself across the Ashley River, or you have to take your life in your hands and try to go across a bridge where you're probably not going to make it all the way across without issues. That's a hyperbolic example, but the reality is that it takes a combination of individuals working together in a community to get their voice heard, to work together with government to put procedures in place to change things, and hopefully to change things for the better. And without that process, maybe one day things change, but maybe they don't. Maybe they change a lot faster through community input and partnerships. And each person, I think, can find what they're interested in. I mean, just to talk a little bit more about activities at the College of Charleston, I recently started a new club with students here called the Sustainable Agriculture Club, where the idea is students can do, you may not have room for a gigantic garden, you may not have room to grow all of your food, but everyone may have the opportunity to do a little something. Maybe you grow some herbs. Maybe you depend less on traveling to the grocery store to buy herbs because you can grow a couple of them yourself. Maybe you grow some tomatoes. It's something you could do almost anywhere. And so the goal is each of us can find our kind of niche or what we're excited about or what we think we can make a difference in, and try to work with others to push that forward just slightly. And by each kind of group or each special interest pushing forward on their particular area of interest, I think we all have an opportunity to develop the future, hopefully in the way that we think is more sustainable, more protective of health, and more beneficial for our environment and our community.
Awesome. Thank you so much. We just got a question from Nicole. We have a little more time. How do we focus on reducing particles that cause health issues in our communities?
This one's really tough. It's, I guess it depends on the sources. I would say if it's a factory-based emissions, you would obviously want to make sure they are following all the standards and all the standards are being enforced. If it's traffic, I don't know what you can do about traffic. If you happen to be living right next to a very busy highway or intersection, expect to see very high PM particles nearby. That will be an issue. Inside of a home, perhaps there can be some measures that can be taken, maybe an air filter, better air filters, but again, that's a cost issue that comes up. So not all air filters are built the same. So if you have to have a really good air filter, that's something that can help, but again, it can be pretty expensive. Other than moving out of the neighborhood, moving into different places, I don't know what other simple solutions are there on the short term. Long term, I'm sure policy mechanisms and other, I guess, infrastructure changes that can be done to mitigate some of those impacts. I don't know what the rest of the panelists think.
No, I agree with Dr. Vulava. It's a difficult thing to tackle individually, and requires kind of a bit of a more collective approach.
Well, somebody asked, I just saw, they asked what can individuals do then to reduce our carbon input daily? So if it's collective action is what we can make big change, what individual things can we do daily that will make a little impact?
Insist on riding in a Tesla for your Uber call? I mean, I'm not exactly sure. Like I say, it's a tough question to answer. That's where I think all of the little things that we could do just to reduce, I don't think we can eliminate necessarily just cold turkey our carbon pollution or even oxides that can form particulate matter, but I think we can take small steps or just be more cognizant of how those particular quote unquote side effects of modern life can impact others. And, you know, I remember reading once about the definition for environmental justice, and you know, some people were interpreting that definition as spread the poison evenly or like equitably, so make sure that everyone gets a little bit of poison. But really it was explained that it's really more about stop the poisoning in a sense. rather than spread it equitably. And I think that's the same kind of feeling that I have in terms of at least for the PM and the carbon part of the PM, is that we can all think about how we could just produce just a little bit less over time, and that can add up and make a difference down the road while we're all involved in these collective, larger, community-driven approaches to improve the built environment, improve lives, and hopefully result in less comorbidity and even morbidity like hypertension and other things associated with these pollution items in the future.
One more thing I just wanted to chime in on the carbon footprint piece. We definitely have a ton of information on that on our website, kind of how you can lower your personal footprint, and that's at musc.edu/go-green. Two things that are not necessarily, you don't think of directly with particulate matter, but it matters for carbon footprint that I like to plug personally are eating less meat. I don't think we don't have to make everyone go vegan, but at least thinking about cutting it down and diminishing it, and that has a huge carbon impact as far as your personal impact. And then on top of that, composting, so not having methane emitted from your food scraps. So those two things I wanted to plug, but thank you.
To wrap up a little bit, we've discussed model communities, air pollution, flooding, water pollution, how the pandemic affects certain communities, and just environmental justice, social justice, and how it all intertwines. So we want to thank all of our panelists, Dr. Vulava, Omar Muhammad, and Dr. Bossack. Thank you guys so much for being here. Thank you to Marla and Jane and John as well. And this recorded lecture, as we said before, will be available on both MUSC's YouTube, which is MUSC Sustainability, and it'll be on CFC's YouTube channel, which, as Jane said, is Sustain CFC. You can follow us on social media. We're MUSC Go Green, and you can also follow CFC, which is Sustain CFC again. So again, thank you everybody for your time, and have a happy and safe holiday season.
Thank you.
Thank you,
Thank
everyone.
Thank you all.
Safe travels.